Good morning, everybody. It is Tuesday, March 31st. I'm Scott Michlin here with Megan Cullup.
Hey, good morning, everybody.
Good morning.
Good morning. How
Glad you're here. I'm good.
Good. I'm glad to be here, too.
Are you?
Yeah.
Okay. Appreciate that.
And look, I'm not in the parking lot today.
No, you have redeemed yourself, and so we didn't send you to the parking lot today, so you're good. But yeah,
cool.
For folks who tuned in yesterday, that was an ongoing possibility.
I was going to say ongoing joke, but apparently it's a possibility,
No.
Gotta be on my best behavior today.
Right.
Okay.
Yes, but I think you will be.
I will be. I will be.
You usually
Gosh.
are. Yesterday was an anomaly.
Scott was almost going to ground me.
Yeah, but we're good. You're back in the building,
yeah.
So everything's fine. Everything's fine. Welcome, everyone. This is our daily, Monday through Thursday, local coronavirus COVID-19 information program produced here at KSJE. And again, it'll be aired later, the audio on our partner station, which we appreciate, KNMI, at noon. And again, here, the audio on KSJE at 5 p.m.
It says that I'm Kim Meisel.
Oh, why are you Dr. Meisel?
I don't know.
I don't know either, but we'll fix that.
Yeah. I mean, I love that. I love the title.
That's the superintendent. You'd be the superintendent of schools in Bloomfield if that was the case.
Yeah.
So,
Dr. Meisel,
I apologize.
Hats off to you.
Right.
Superintendent, not really my speed.
Right. But it could be.
Sure.
Maybe.
I'd have to go get a PhD though.
Another life, maybe.
Right. Another life.
Right.
Alternate universe.
We'll try that.
We'll try that.
There's a comment.
Yeah.
See?
Dr. Meisel is looking different this morning. Yep.
There you go. How's that?
That's good. Good
now,
spelling. Yeah.
Pardon me, everybody. Yeah, that is a operator error. I apologize.
Yes.
So,
okay.
there you
All
go.
right. Back onto
the show.
Yeah.
Right. Thanks for
Sorry.
all that. Now I guess I have to go to the parking lot. So, right,
Ouch!
everybody. Let's go to the phones.
Yes, please.
How about that?
For the love of God.
That will get us going this morning. And good morning. You're on KSJE. Who's this?
This is Betty Decker with the Farmington Public Library.
Hello, Betty Decker from the Farmington Public Library. Thank you for calling in.
Thank you for having me.
You bet, you bet. And so our friends at the Farmington Public Library, the library building is closed, but the library has tons and tons, I was actually looking at the website earlier, tons of online resources. And Betty, that's what you are here to talk about, if I'm not mistaken.
That is.
Cool.
We have quite a variety of things for you to do while you self-quarantine at home.
Excellent.
Like what?
So there's two different things that you can do with us. You can download books and either listen to them or read them, and that's through our partner vendor Overdrive. And we've got over 23,000 titles for you to choose from.
Wow.
And they go on anything from your smartphone to you can just read them from a computer screen as long as you have internet capability on the computer screen part. On your phone, once you get it downloaded, you don't need the internet anymore.
Okay.
Amazing.
How about
23,000 titles?
Yes.
Wow. And how long can you check those audio books out for?
You have the choice. So it defaults to 7 days when you first get in there, but you can change that to 14 days or 21 days.
Okay. Very good.
A lot of people tend to do the audiobooks a lot quicker, so they have a tendency to just check out the 7-day version and then keep checking out more and more and more.
Sure. Put it on the background while you clean. That's what I do.
Yes.
Yeah.
Well,
there you go.
My husband works for the BLM, and when he drives all the way down to Cuba, that's what he pops in.
Oh, that makes sense to me. Yeah.
That's
and
smart.
Then it'll just go through your car stereo, and you can listen without losing your service all the way down to Albuquerque even.
Well, there you go.
That's what I'm talking about, Farmington Library. And you mentioned one other source. What is that?
The other source is we have over 70 different databases that you can use from home. And when I say databases, it's just kind of like a catch word for that. They're anything from a language database where you can learn pirate.
The language?
Yeah.
Okay, that's what I thought you meant.
Wow, I have not heard of this
And I
language.
thought that Megan would sign right up for that.
Yeah.
I can't imagine you not wanting to learn pirate.
I mean, matey.
That's right.
Is that pirate? Yeah.
It is the best one. I love it because there is a Speak Pirate Day.
That's right.
Wow.
And so it's actually called Mango Languages, and they have a variety of different languages, and they have, you can create an account, and it's all free because you've put in your library card and your PIN number. You create an account, and you can run tests where they quiz you on things, or you can just have a conversation. And that way, once you log in, if you need to log out for any reason, then it'll hold where you're at.
Wow, I'm definitely signing up for Pirate. Get ready.
But we also have, like, if you don't really want to learn something that is a language or maybe really educational, we have things like Creative Bug, which is a database in conjunction with Joann's fabric stores, and they teach all kinds of crafts. So if you want cake decorating, it's in there. If you want quilting, it's in there. If you want jewelry making, it's in there. Or leather making, it's in there.
Wow, that's amazing. So, Scott, are you going to sign up for quilt making?
I will if you will. How's that?
There's several different classes, and y'all can each make your own different version.
That's amazing. So we just go on to Farmington Public Library, the website, right, and check out online resources. It's a tab, and go from there.
Infoway.org.
Yes.
And I'm looking at there's an A to Z list, Megan Cullup, as you can see on the screen right now. And as I start scrolling through it, these are all the online resources. And so, Betty Decker, I know...
Auto repair source. Oh, my goodness.
We definitely need a library card and PIN to access all these, right?
Yes. The moment you click on one, it'll go to open, and then it'll ask you to log in with your library card and your PIN number. And once that does it, anything you do in there is free.
Free. Nice.
Free. Free.
That's incredible. I see live homework help. That's amazing.
Right, yeah. Always, exactly. And so if someone, and I know the library cards need to be I don't know what the term is that you call it, but sometimes they'll expire and you need to be reauthorized, renewed.
Perhaps is what you're looking for,
on a yearly basis.
Yes, they need to be renewed on a yearly basis. Now, one thing that we've done during this time, if your card expired anytime between, I believe it's March 1 to now, we actually just put that all off until, I believe, after August.
Ah, okay.
So if it expired before March, then you can call in, and we'll run you through a couple of steps to, prove that you're you.
Right.
And we'll renew you for a year over the phone.
Okay. So even though the library building is closed, you still have folks standing by to help us by phone.
We are, because we do get questions. I had a patron yesterday who called, and she just couldn't get her Kindle to work with the Overdrive books. I walked her through a couple of steps, and we got it fixed, and she's happily reading her books on her Kindle.
Well, there you go.
That's amazing.
How about that? Perfect. Well, Betty, thank you for calling in to let us know about all these opportunities at the Farmington Public Library. Again, infoway.org and all these online resources. There's a ton of them for sure, so that should certainly help during these times. So thank you.
Thank you for having me, Scott.
You bet. Always great to talk with you. That is Betty Decker from the Farmington Public Library, everyone. Speaking with us on our show.
That's
Megan,
amazing.
Is your mind blown? It looks like it.
Looks
like it is.
It is. It is. I'm just looking through the alphabet there. Possible genealogy. Perhaps I'll check out my heritage. I don't know.
Exactly.
I don't know if I want to, but
you never know. That's
you never know. Yeah.
Okay. Well, cool. Well, let's go back to the phones.
Yes, I see
the
that
phone lines are lit up.
Lit up.
See what happens.
We got two on hold.
We do. Good morning. You're on KSJE.
Hey, it's Jenny Lee at the library.
Oh, hey, Jenny Lee at the library. You said you were going to call in with Betty, didn't you?
I did, yes.
You did, and here you are. And so let me get Betty back on the phone.
Okay.
Betty Decker, you're still with us?
I'm still with you.
Now, look at that, through the miracle of technology.
Double blown this morning.
How about that? So, perfect. So, Betty just did a great job explaining to us the online resources. Jenny Lee, of course, you've used these, I know, and have talked about these before with me.
Oh, absolutely. I love our online resources, especially Creative Bug. Did Betty discuss those?
I don't
think
believe
so.
she did. So please, by all means, Creative Bug.
You can subscribe to, but the library has paid the subscription, and there's a ton of great crafting ideas, stuff you have around the house that you can try out if you've got a Cricut. I know I've discussed this.
You have.
I know. You can use your Cricut, but there's all kinds of high-tech, low-tech, everything in between. So if you're getting bored, check out Creative Bug. It's absolutely free through the Farmington Public Library.
Okay.
So I'm looking it up right now to see if we have...
Oh, I did talk about this, Jenny Lee.
Yeah?
And Scott's going to start quilting.
Yeah.
Oh, good.
Oh, good. Scott's going to quilt, and I'm going to learn pirate.
That's it.
Excellent.
How about that?
Oh, that's awesome. So I know, like, Cricut Online is doing patterns to make masks. So if you have a Cricut, you can cut out your face mask and sew it together, and there's instructions. And I'm looking right now, and let's see if I can log in, if I remember my login.
Okay. If you don't, there's someone at the library that can help you.
There is someone at the library that can help you. So yeah, they probably have or will have something about doing your a mask.
Okay, got
So
it.
a stylish mask.
Oh.
See?
Yeah.
Wow. Fighting off disease in a stylish,
Right.
hip way.
How about that?
I like
Well,
it.
obviously.
Obviously. Only you, Jenny Lee.
I know,
That's it.
right?
Perfect.
Well, just because we're quarantined doesn't mean we can't be stylish. Okay, I don't see anything on there right now, but I'm betting it's going to happen pretty soon.
Okay.
So if Creative Bug doesn't have it now, they'll have it soon. And then I also want to remind people, so I am manning the phones or personing the phones, which is not my usual job. So the main call that I'm getting is people that are concerned about books that are due.
Oh,
We've extended all the due dates till May 15th. So hang on to the book. There's no reason to panic. Fines are not accruing. So it's okay. We've got your back on that. So if you do have library materials, you're welcome to hang on to them.
Okay. Good to know.
Yeah.
And if someone still did want to return their items, is the automatic return still operational?
Automated return on the west side of the building. You can return books there. You're welcome to, but no hurry.
You don't have to.
Don't stress out. Yeah. Don't
Okay.
leave your house just to return your books, because that would kind of defeat the purpose, right?
We're supposed to stay home. You're right. That's true.
Stay home.
True.
So, very good. Well, Jenny Lee, I appreciate you calling in. And Betty Decker, of course, thank you for calling in.
Thank you, Scott.
You bet. And we'll visit with you guys again as this goes forward with there's more stuff to share from the library.
Speaking in pirate.
Yeah.
Yes, absolutely.
Okay. Our
So-
next interview will be in pirate.
Yeah, watch our Facebook
I need to
page.
go
We've got
brush up.
updates all the time.
Arg.
Thanks,
Okay.
guys. Thanks, guys.
Avast ye mateys. Walk the plank.
Oh, my God. Stop while you're ahead.
Off they go.
Okay.
Okay. That just happened.
That just happened.
Yes, it did. All right.
Do we have another caller? Is
We
that
do.
what I see?
We do have another
All right.
caller. Good morning. You're on KSJE.
Hey, good morning. This is Keba with San Juan College.
Hey, Keba. How are
Hey.
you from the C.A.S.A program, part of Child Haven? Thank you for calling in.
Yeah, how are you guys doing this morning?
We are well, thank you. And you are joining us because you have some important information about the semi-annual training to become a C.A.S.A volunteer, right?
Yeah, so we have training. Originally, we were saying we have spring and fall training. We are still going to offer pre-service training for spring. April 7th is our first day. It's not going to be an in-person training anymore. It's going to be a guided learning virtual experience that we as C.A.S.A volunteers will be offering it through, Zoom.
Okay.
Training.
Like everything these days.
Right, the zooming around these days. So, can you briefly tell us what exactly a C.A.S.A volunteer is and what a C.A.S.A volunteer does?
Yeah. So a C.A.S.A stands for Court Appointed Special Advocate. So we're advocates, we're a trained community volunteer who advocate for a child here in San Juan County who has, of course, a legal case due to abuse and neglect. And I'm sorry, I forgot your other question.
Well, that's basically it. Yeah, volunteers from the community who advocate for children in court who are in situations of abuse and neglect. And I know that you guys do great work. And so I also know, though, that there's an application process, of course. And so if I was interested, when would I have to turn that in?
Still, we have to application by April 7th. So if anybody's interested, April 7th is going to be the deadline because we are going to, group everybody in anticipation. Still only take a couple of weeks to do this. Each module is going to take anywhere from 3 to 6 hours to complete. And so if we get anybody after April 7th, it would be kind of hard to catch people up. If we get somebody after April 7th, we would still love to work with them, but we don't know if we're going to have another opportunity in the summer. It's hard to say because nothing is guaranteed right now, but we will definitely come back together in fall for fall pre-service training. So there's still an opportunity. There's still a need in our community, and so we are always up for people who are willing to help.
Good to know.
Yeah. That's
Very
great.
good, Keba. And I know, go ahead.
Oh, I was going to say, and anybody who's interested could always go to the Child Haven website and look under our C.A.S.A program, and the application is there. We will be posting our update schedule that we are currently kind of finalizing. It's going to be the same experience. There's just not going to be any presenters. It would just be all staff members.
Great.
Gotcha.
So if I'm interested, I go to childhaven.org and check out the CASA tab.
childhavennm.org.
Oh, right, NM. Yes. Sorry, my apologies. Yep.
Okay. You can go to that other website.
I can go to the other website.
I can't tell you this.
See what they have for me.
Go ahead.
Yeah,
check it out.
why not?
That's true. So, very good, Keba. And again, I know you've still got folks on a waiting list to get a CASA volunteer too. So the need is great, is it not?
Yes, it is. So we are currently monitoring about, I say, 17 kids now. So as before, it was only 11, and so it's growing.
Good.
And then we also are probably serving about 92 kids here in San Juan County. So, of course, the need is always there. We'd like to be 100%. We have about 10 trainees currently signed up, which is a good number. But if we can get a few more, then we could probably hit that 100% before we get to fall, which would be great.
Okay. Very good.
Wonderful.
It's a great service to the community. Thank you very much.
Yeah. Well, thanks for having me, guys, and I appreciate, letting us have the opportunity to try to get more individuals. And then, of course, I should say this, background checks in San Juan County are kind of on hold. So when I get a new trainee, it might take a little bit longer to get them started just because fingerprints are only for the medical field at this point.
Gotcha. Good to know. All right.
Yeah. Okay.
Well, thank you. Have a great one.
We've got the word out. Thank you, Keba.
All right. Thank you. You guys have a good day.
You're welcome. You too. That's Keba Gorman from the CASA program at Child Haven with us this morning on our COVID-19 local community information program. So that work continues.
Yeah, no, they do amazing work. Can't sing their praises more.
They really do. All right. We have another caller.
Oh my gosh.
How about that?
What a banner day.
I know. We love getting calls. So good morning. You're on KSJE.
Good morning. This is Stacy Beal. How are you today?
Hi, Stacy. I'm well. Thank you. Thanks for calling in. I asked you to call in this morning because I know you've been doing a lot of work with the Facebook group about the mask situation, right? Can you give us a little bit of an update?
Yeah. So I did a little message on Facebook asking where and if there was a need for masks, and never knew how big of a need that was going to be. So
you heard from a lot of people, right, when you set that little message out?
There's a lot of angels out there willing to help, and it's been so rewarding and just heartwarming.
Wonderful. So tell us the name of the group that you formed on Facebook if folks would like to join your group, because I know you've been sharing a lot of information about putting these together and sharing resources to get materials and things like that. So share the name if you wouldn't mind.
It is Making Masks for San Juan County. It's the Facebook page.
Okay.
So if everyone that's interested would join, we'd really appreciate it. We have, we're asking that people donate fabric and elastic. If they can cut, we have packets out there of fabric that's been donated that they can grab and cut into 7 by 9 rectangles. And then we also, once the fabric's returned, we make it into packets with enough fabric and enough elastic and the directions to make 25 masks. So we've really gotten a great response. It's awesome.
That's wonderful.
But we need more. I mean, we have such a demand.
Right.
We get requests and we just don't have the mass to be able to fulfill it. We don't even come close. I mean, it's not only our healthcare workers and the nursing homes and people that are at home under some of the home healthcare agencies, but it's also the people that work at our convenience stores and at Target and, Walmart, all those places that you might not really think about, the grocery stores. I mean, there's so many businesses that are still open and are open because they're deemed essential, and they're having to deal with a lot of people. I can't imagine having to work like that. It would be so scary.
That's a good point. And Stacy, you mentioned the fabric. Is there I know there's particular types of fabric that are better than others. Is that true?
It is true. What we want is a tightly woven cotton fabric.
Okay.
So, and we do, for any of those expert sewers out there, Travis Rogers was so nice to donate hundreds of yards of hemp product that it has antibacterial qualities. But it isn't. For people that don't sew, it's kind of like a double knit, like a T-shirt fabric.
Right.
And so it actually takes a special needle, and you have to zigzag, do small zigzags instead of a straight stitch. And so it's been a little overwhelming for some of our sewers, some of our seamstresses, because it's different than what they're used to, and they may not have the right needle, that type of thing. So any expert seamstresses out there that can help us out, because it is such a great product, and it's been a little disappointing that we haven't been able to get it out in the mass like we wanted to.
Okay, but it sounds like, Stacy, you, from the donations, you have fabric. You're just looking for more folks to put this together into the different types of masks. Is that the idea?
Well, we need more fabric too.
You do? Okay. You've got that type of fabric.
Yes. Yeah, and I have that fabric, but like I said, it kind of takes a special like experienced person that's sewn with that. But yesterday I ran out of fabric. So, and then all of a sudden I went to my front door and there was fabric there.
Well,
so yeah, it's really rewarding. And
the fabric fairy has stopped by.
Exactly.
But
wow,
we're hearing lots of stories though like that around the community, right? Of folks who have a need, and all of a sudden other folks step up.
It's insane. Also, I had no idea that the world of like seamstressing was so deep. Hemp is a natural antibacterial. I mean, like, my mind is blowing all morning over here. So.
Well, and everybody wants to use it because what a great thing to put in our masks.
Hemp.
But it is difficult to handle, and it's hard to cut too. So,
okay,
a big shout out to the people out there that have helped cut it, because it's been a real chore. And then we're also making the caps for people at the hospital. And we found a great family, and they had a laser cutter.
Okay.
And so they cut the patterns for that, and I will have those out there now too, and I'll have directions for them so that they can sew the caps.
Okay.
And it's also on the Facebook page.
Your page.
Yeah.
Excellent.
Yeah.
And I know we've shared some information about some headbands or caps that folks were wearing, and they put buttons on them to maybe hold the straps from the masks, and that seems to be a pretty exciting idea for folks to have to wear these things all day because their ears get kind of sore from the straps, but put on buttons on the headband. That works out a little better.
Right. So people have been so creative because, we had run out of elastic, and it was crazy how creative people were and what they came up with to, uses of elastic. It was great. And then, thank goodness, Travis Rogers had ordered hundreds of yards of elastic, about 750 yards, I believe. And then we ran out yesterday. There's just a little bit left on my porch. And now the new shipment's supposed to come in tonight. So, and I've actually spent my evening last night cutting the wide elastic into narrow strips so that we can use that. We don't want anything to go to waste. And of course, you can use ties. A lot of the medical professionals would rather have the tied mask because their ears get so raw.
Right.
Having the elastic. So.
Good point.
Yeah. So.
Well, very good.
We really encourage people to come out and join our website, our face page site, and I have packets on my porch with the patterns and a kit. It's ready to sew. So, and there's fabric that's ready to be cut.
All right.
We would really, really ask that people give us a hand. It's pretty overwhelming.
Right, Stacy. Well, thank you. And tell us the name of the page again, and then we're going to let you go. I know you want to get back to work probably.
It's Making Masks for San Juan County.
Okay, and we'll share that on our on the page as well, on our page and on the video. So thank you, Stacy, for calling in, and appreciate all the work that you and your other volunteers are doing.
Well, thank you, and thanks for helping us get the word out.
You're very welcome. You're very welcome. That is Stacy Beal, who is doing a lot of work with her volunteers to get these masks out.
Yeah.
You were working with masks yesterday.
Well,
weren't you?
we were sending some to Shiprock.
You were talking about IHS, right?
Right,
IHS.
Hospital, right? And Bloomfield Senior Center was the organization that helped us with that. So
right.
they made 100 masks by like 3 o'clock yesterday, which is amazing. And I only have one question for those who sew.
Okay.
So if it's a dude that's seamstressing, is he a seamster?
That might be. All right, we'll get back to you on that.
Yeah, right.
Okay.
Call in.
We'll let you know.
Okay.
We do another call.
Hey, really? Awesome.
Good morning. You're on KSJE.
Good morning, Scott and Rev Meg. This is Nate Duckett. How are you guys?
Mayor Duckett. Nice to hear your voice, Mayor. Thank you for calling in. How are things going for you?
Oh, things are going, Scott.
All right.
Going. It's an interesting time to be alive, let alone be in a position where you're trying to make sure your people are staying as safe as they possibly can. So,
well, that's true, and I know the city has really taken the lead in trying to remind all of us to stay home and stay safe and stay well. And there's some more messages going out about that as we speak. I know, right?
Well, and the urgency is now. So it's one thing for those who are on social media, they see those messages on a regular basis. I don't think we're getting far enough out into the county to our retail hub area to ensure that message is being seen by those who utilize us as their source for all their resources. I mean, I think it's important for people to know if you're out on a Saturday and you see that Walmart seems to be busy or Home Depot seems to be busy, that is a store that's used by people 3 hours from here. I mean, so we need that message to get out there further. We're working on that today, actually. They'll start utilizing our emergency text system in order to get information out to every cell phone that's connected to a cell phone tower in San Juan County. So those will start being heard. And then last week, many of us recorded some stay-at-home messaging that we will be getting on Comcast and on the radios. So
very good.
We're trying to definitely push that message hard.
Well, we're looking forward to sharing some of those with our audiences as well, Mayor Duckett. And I know as far as the city goes, I mean, again, the city has been responding and stepping up to kind of helping folks through all of this. The city services, of course, need to be maintained, and that's important as well, right?
Well, that is the goal of why there are restrictions being put in place to begin with. The critical workforce, we can't say how important it is to keep them healthy. And it's a scary time for those individuals as well, knowing that they're in a position where they are needed, they are essential, and they need everybody else around them to respect that and do all they can to keep themselves healthy, their family healthy, so that these workers remain healthy as well. And that goes all the way down from police and fire to ambulance to our doctors, but also we can't forget about the importance of having electric utility workers who are healthy, wastewater and water treatment plant people who are healthy, the grocery store workers. I mean, you just keep going down the line and you think, well, where would we be if all these people went down? So it is critical that we take the responsibility on ourselves, not just to keep ourselves from getting sick, but ensuring that other people don't get sick. And the only and best way we could possibly do that is to minimize our human-to-human contact in every way possible. Stay at home. I've got my office set up right here in my dining room. I'm sure my wife is not happy that I've chosen the dining room for this location, but it does have a nice view of the backyard, and so it's probably the nicest office I've ever had.
There you go.
My kiddos are set up upstairs in another room where they're doing their schoolwork. So, and Barbie's at work today at the hospital, and we're taking precautions. We got a protocol set up of when her and I both come home, if we've been out in the public and coming in through the garage and stripping off clothes there in the laundry room, immediately putting them into the clothes washer, and then going straight to take a shower before we interact with anybody in the household, and wiping down repeatedly throughout the day if I'm going from place to place, which, by the way, I've minimized as much as possible now. Today I'm
Sure.
not going to go anywhere.
Well, and I know exactly. Normally you're a guest here in studio, Mayor, but today you're calling in from home, which is smart, and that's kind of the idea.
Man.
Well, thank you, Mayor. I appreciate that. But there's plenty of videos online, believe me. So just to get your fix, you can binge watch KSJE
Binge watch Scott
all
Michlin.
day.
Oh, wow.
If you choose.
Wow.
But it's great advice, and that's something to think about. Again, the advice has been to, wash your hands, don't touch your face, and all those things. And if we minimize contact, that's even one step further, and that's what you're suggesting, which is important. And I think the other messaging is, if we need to go buy groceries, make a list and only plan to go, once a week, once every 2 weeks. That wouldn't be bad either, I don't think.
Right, and only send one person from your family to do it. I mean, I think that's a really important component that people need to think about. I'm the kind of person, life is a journey to me, and even the menial tasks of going to the grocery store, I'd love to bring one of my kids with me and make it a fun experience, but that's not going to happen anymore. And so, and to that extent, that's why this messaging going out further into the county, reaching our neighbors on the Navajo Nation, because when they come to town, it's a family thing. Mm-hmm. And right now, we got to change some of those habits, those things that we do with our families. We have to make an adjustment to protect ourselves. And we all, those who've lived here, we understand that there's a lot of multi-generational households, specifically on the Navajo Nation, obviously elsewhere too, but to the extent that grandma and grandpa and son and daughter and grandkids are all living in one household, they're really susceptible to respiratory illness. We need everybody to do their part to protect each other, and that's why it's so important to get the messaging as far out as we can, and hopefully see some turnaround on that. But we have to do what we can, each as individuals. One thing we can't control is what other people do. We can only control what we do, and what we have influence over would be our kids and our immediate, and certainly communicating to our friends and neighbors as well.
Good advice, Mayor Duckett. And again, from your wife's perspective, how are things going at the hospital? I know she's not an official spokesman of the hospital, but she's certainly there and doing the work. We're talking with folks from the hospital on this program, but how is she doing?
She's good. She's a labor delivery nurse, 20 years now almost, right. I think. She's been doing that profession, and so her expertise lies in that realm of moms and babies, and she just talks about the new protocols of what they have to do to protect themselves and those kind of things. But it's kind of business as normal up on that. What's going to end up happening, though, Scott, is after a period like this in human history where a lot of people are having to stay home, there's going to be a lot more babies probably. So I would imagine they'll be a lot busier 9 months from now than what they are currently. And I'm sure, speaking of the hospital leadership, we got an update this morning. The census there is one of the lowest it's ever been. So the hospital has not a lot of people currently in it. The ER people visiting is way down, which may be just a component of people staying home. I think that's a good sign. We need that space. There is certain modeling that's coming out that shows the next 10 to 14 days that there will be a surge of positive cases here in San Juan County. I mean, you just look around us, consider the number of cases growing in McLeod County, the number of cases growing in the Navajo Nation. We are that hub again for not just retail, but also for medical care. So I believe that the hospital is doing all they can. We need PPE We need masks. We need all these things that the governor is clearly aware of. We had a conversation with her last night specifically to the needs of San Juan Regional and just the medical need regionally as we look to what this next month holds for all of us.
Right. Well, I guess it's maybe encouraging news that there are, the census is down at the hospital. There is room for patients if we need that. And, of course, we're all working very hard to flatten that curve, as we've heard. But as you say, the worst is still ahead of us, I'm afraid.
That is, I believe that. I think, and it's important for people. I know it's easy to get kind of, are we, the questions being in your own mind, are we doing all this for the right reasons? Are we just killing our economy? Are people losing their jobs? Kids can't be in school. I mean, all of these things that are just, they're foreign to us. I mean, these are concepts that you can't possibly imagine would happen to America. That's the thing I think probably gets me more than anything. You may hear about certain breakouts of disease in other countries, but you're like, surely that would never happen here. Well, it's happened before. It's probably going to happen again, and it's happening right now. So right now we have to ask ourselves, are we willing to do the minimal sacrifice we need to make? And I say minimal only to the component of staying home, but for folks who need to work, who are working paycheck to paycheck, it's a whole different story for them. This is a very scary moment. And so I hope that they're getting the information they need on what the federal stimulus package entails, make sure that they are getting that information from reputable sources, reaching out to experts in it. A lot of great information has been put online and shared on social media. The Chamber of Commerce here also has some fantastic info that we've been sharing with them as well. So, we've got to just do what we need to do right now for a short period of time so that we can get back to business as normal. But that short period of time, the longer it continues to spread, and the concerns that it's going to overrun our healthcare system, those things haven't happened yet. And so the feeling is that, well, at some point it seems like it's going to happen. So when? Right. Well, just hang tight. The numbers obviously from Friday, here's a great example. I know the numbers don't seem big to some degree, but Friday there were 14 cases, and as of yesterday there were 27 cases here in the county. So they doubled in 3 days.
Right.
That's an important component to know. And again, you can question, well, when were those people tested? And look, we have to stick with something here and realize what we're seeing in Italy and what we're seeing in Spain. What's going on in those places, it can very, very well happen here. So the only way that they know to address that strategically is to do what you can early, and before it erupts, do what you can early and minimize human-to-human contact. I mean, that's the really only strategy that works, because there's no cure. The only cure is not to get infected. That's the only cure right now. True.
Very true, Mayor Duckett, and it's good advice to just stay home and stay well, and that is what we're advising everyone to do. So we appreciate you joining us today.
Well, I'm glad. Thank you for taking the time each day, Monday through Thursday, to kind of have this open forum and discussion. I think it's really important that people tune in. Obviously, it's being aired on multiple radio stations, online, YouTube. This is a great forum for this, which allows us to get that message out further. So I just appreciate, Scott, you and Rev Meg, my rock star, just doing such a great job and keeping our community informed and together on this. It's going to take all of us, and just tell people to be resilient and vigilant and find some fun things to do around the house.
That's true.
That is true.
Very true. And you're exactly right, Mayor Duckett. We're all in this together, as we've said before, and we're glad to be able to provide this public service to the community. And thank you for being a part of it, too, because getting information out from folks like you who've talked to the governor and talked to folks who are making these decisions is very important to share with the audience as well.
Absolutely.
The mayor of the Mesa, Nate Duckett.
The mayor.
There you go.
Yeah.
All righty.
There you go. You found one.
Yeah, finally.
Okay. Mayor, thanks so much for taking some time. Thank you very much.
Yes, sir.
All right. Mayor Nate Duckett, our guest here on our local information. community information program. I'm Scott Michlin along with Megan Cullup, and lots of information today. How about that, right?
Today was jam-packed. I love it.
Right?
I love it.
We haven't even looked at the numbers yet.
Yeah, and I did look at the numbers.
You did look at them already.
I cheated.
That's okay.
So
it's on the website.
That's true.
So folks can do that. But let me call them up here for folks if you want to see. But we are
my count. We have 5 new cases in New Mexico and 4 new cases in San Juan County just from yesterday. So we went up by 5 statewide and 4 countywide.
Right. Total of 237 now. San Juan County 27. 4 deaths. That's 2 additional deaths in the state from yesterday. And then the recoveries are still at 26. And so folks might say, well, what is that? Then what about those other 200 folks?
What that means is it's always exponentially increasing.
Right.
So,
but those folks that then have not recovered are still considered with the virus, and they're still quarantined or they're in the hospital, and that's what's going on with them.
Right.
So that's what's happening. If we scroll down, and again, everyone, we're getting this from the KSJE.com website. We have a special section dedicated to coronavirus news, but I do want to share a couple other things if you're ready to move on.
Sure.
Megan Cullup from the numbers. The Navajo Nation began a curfew last night.
We gotta grab one of them to talk to us about
8 p.m. To 5 a.m. Curfew. They were out stopping vehicles and just giving out pamphlets about why they are doing this, reminding folks to stay home. And so that's what they were doing last night on the highways around the Navajo Nation. Again, right next to that story is the updated story about the Navajo Nation numbers. They're now, for just the Navajo Nation, at 148 cases and 5 deaths across the Navajo Nation. La Plata County now with 23. So again, we're not sharing these numbers to bum you out, but just to share the information. And then this other story that I did want to point out too, the Department of Health offered some screening guidelines, to try to.
Oh, good.
There's a tool in that story that takes you through step by step of your symptoms or what if or what's going on. Should I get tested? Should I not get tested? And there's a number to call. So I think that's really important as well.
That is very important.
So I wanted to share that. And then, of course, the other story about the Southern Ute tribe confirming 2 positive cases in Ignacio. So there is that as well.
Right. So not scaring you, but reiterating that
this is the information.
This is information.
And this again is why we stay home.
This is also why we stay home.
Right.
Yeah.
Because there are cases
it's a serious
throughout
issue.
The 4 corners. No matter where you are, there is probably someone, a case near you. So
no matter where you are, listener, there's a case near you. Well, that's what I was telling you about that story that I read about how, the information that doctors and scientists are learning is also changing almost by the day.
That's true.
And as they study this thing more and more, and now they're discovering, that they call it an aerosol illness where it just hangs around in the air for at least 30 minutes, which is a bit different from
other types of viruses.
Types of viruses
that they've
been studying, and other ideas that they had about this virus. So
that's very true. We do have another caller.
Bring it.
We're ready?
Yeah.
All right. Good morning. You're on KSJE. Thanks for calling in.
Good morning, Scott and Megan. How are you doing this morning? This is Les Leach.
Les Leach.
Oh,
Les
Leach.
Well, how are you? Thanks for calling in, Les Leach.
Well, it's not a great reason that I'm calling in. But I thought it was important for people to be really aware of the number of phishing and scam efforts that people are going through out. I got an email yesterday regarding the program, the new COVID-19 relief package.
From the government, right? But it wasn't from the government. Yeah.
Right. This was not from the government. It was there's a Fresh Start program that IRS has that is a legitimate program, from what I understand.
Right.
And it is designed to give assistance to those people that owe taxes. However, this email that I got yesterday said it was from Fresh Start IRS, but it was not.
Gotcha. Good advice.
So I called a couple of people and confirmed that it was a phishing effort there. So I deleted it, but I also sent it to if you get an email that is phishing like that, you would send it to phishing, and that is spelled PHISHING,
right.
phishing at irs.gov.
Okay, and you can report that way. But you're right, Les.
Right.
And thank you for calling in to share that. I appreciate it very much. That's you're exactly right. We've got a lot of concerns about that with more students working online. They could be at risk, perhaps, and just everybody being maybe more online could be more at risk. So that's always something to be very careful about. And these days is no exception. So, Liz Leach, thank you very much for calling in. How about that? Another message online. I think just cut you off. I think they really meant Megan, but just says thank you,
Scott and me.
Yeah.
Gosh.
I think the GAN is there.
Yeah.
You just can't see
always
it.
the second fiddle.
It's okay.
Just kidding. It's okay. It's okay.
I'm okay with that.
Yeah. Scott is absolutely 100% okay with me being the second fiddle. You heard it here first, dear listeners.
I'm touching the buttons over
You
here.
are touching.
So
okay.
that's what happens.
So are we ready for a positive note?
But you're not in the parking lot. So that's
I am not in the
too.
parking lot
so how about
with a
that?
cell phone. No,
right.
Yeah, no.
So we have that. Okay.
I'm here.
All right. I think we're about to wrap up the show. Look at this. It's almost 10 o'clock, for heaven's sakes.
It was great. It's a great show.
It was a great show. Lots of great information. Thanks to everyone who called in and who contributed to the show. Please share this. Again, if you know someone who needs this information, please share it on your social media, or again, remind them it's on the radio.
That's right.
KNMI 88.9 at noon, Monday through Thursday. KSJE 90.9 and 103.3 at 5 p.m. Monday through Thursday. So
that's right. One might say that we're going viral.
One might say that in a good way.
In the good way.
Yes.
Speaking of good news.
All righty. I'm ready for it.
Okay.
I'm ready.
Cool.
What do you got today?
Bear hunting.
The bear hunt.
The bear hunt. Yes.
Yes.
So I discovered this. A good friend of mine told me about this last night.
Right.
That apparently
it's happening.
It's happened. It's a thing that's happening
in our community,
in our town, and
that's
we're not talking about bears in the literal sense, But we're talking about people putting stuffed bears, pictures of bears, whatever, in their windows, and then parents are driving their children around to go on bear hunts. So,
right.
Which is, this is news to me. I don't have that. I don't have any stuffed animals in my adult home, but I'm thinking about Googling a picture of a bear and then photoshopping a hazmat suit on him.
Okay.
Just to be funny.
Right.
Okay, so you're pulling it up now, huh?
I'm trying to. Let's see how we do here on the Facebook.
The bear hunt in San Juan County.
Right. Let's see here, everybody.
It's an easy way to join in on the fun, I think,
Right. So let's see. It's an event, I guess, it's going on, right?
Okay,
and so bear hunt in San Juan County for the kiddos, and it shows you kind of all the things that you can do. But you're right. The idea is to put a bear in your window, and as kids drive around, or I guess you could walk through the neighborhood.
Sure, walk through the neighborhood.
Less than 5 people.
Right, if you're keeping your distance.
Practicing your physical distancing. Yeah. And you can spot the bears that are looking out from the window.
The bears, at
the street.
Yeah, it's very sweet.
It's a bear hunt.
It's a very it's a very creative and endearing effort.
Doesn't cost a thing.
Doesn't cost a thing.
Right?
A
few seconds. Just stick it in the front window.
Yeah.
So,
it's cute.
There you are.
Yeah.
I like that.
Cool.
We'll end on a positive note.
Yeah.
Perfect.
Put your bears out.
All right. Megan, thanks for coming in. Bree here, as always.
Yes.
We'll be back tomorrow, everybody. This is a show we're doing as long as we need to do it, basically. Monday through Thursday, we are committed to doing this show. 9 a.m. right here on KSJE. And again, you can listen on the radio later on at 88.9 Vertical Radio, KNMI, at noon. And then at KSJE 90.9, 103.3 FM at 5. And, of course, it's archived on our Facebook page and YouTube channel all the time, so you can just go there and watch it. As I told the mayor, binge watch us during this time.
Binge watch the two of us.
I don't know what else the mayor could be doing, but then watching Scott and Megan. What else could be more important?
What else could any of you be doing?
I know. There you are. Anyway, thanks for joining us, everyone. Stay safe, stay home, and stay well. I'm Scott Michlin. And this is Megan Cullup. And this is KSJE. See you tomorrow.